WFNZ.
Live from Studio A at the Cumulus Broadcast House, it's Health View with your host, Dr. Angela Ruff. Your information leader for more than 65 years. News Talk 640.
WFNZ.
Good morning and welcome to Health View. This is Dr. Angela Ruff and our guest this morning is Dr. Forsyth. Dr. Forsyth is the president of Capital Family Medicine in Raleigh, North Carolina. And our discussion this morning will be about sleep disorders and hopefully some solutions to overcome some sleep disorders. Dr. Forsyth, thank you for joining us this morning.
Always.
Well, good. Great. The first thing I wanted to ask you about was just, insomnia. What causes this, and what are some things that we can do to overcome this?
My gosh, Angela, insomnia is, you can tell what an incredible problem it is in our society when you turn on the television and we see the advertisements every night for sleep problems. And as you know, we read in all our magazines about the various sleep disorders, the restless leg and the snoring and the sleep apnea. But when it comes to insomnia, we generally look at insomnia as being either primary or secondary. And when we mean primary, we basically define that as the insomnia is the only problem, and we generally define it as lasting over a month or more, and not associated with any other medical disorders. Whereas a secondary insomnia would be related to pain, anxiety, depression, some kind of sleep apnea situation. And that's basically what we're talking about.
And so is it described as insomnia if you just can't get to sleep versus you wake up in the middle of the night?
It's all insomnia, Angela. What we consider it's problems with initiation, it's problems staying asleep, and when you do, it's pretty normal, especially for older people, to wake up in the middle of the night. But we define it as insomnia when they can't get back to sleep again.
So what are some things that we can do to avoid this problem?
Well, a lot of this is experiential. I think we have some problems that are very, very difficult because so many of us don't allow enough time for sleep. I see in my practice many people who are working second and third shift, and unfortunately, a number of those people are shifting from first shift to second shift to third shift, and that is a tremendous issue. Obviously, for these people, what we try to emphasize to try to live like they were on first shift. We try to get them to eat at scheduled, proper times. We try to get them to get a very, very dark room to sleep in. Try to get the annoyances, which sometimes are impossible, frankly, Angela. It amazes me how so many of my patients deal with what they have to deal with. If they have young children, it's fine for me to say, look, I want you to come home at the end of your shift at 7 o'clock. I want you to go to bed, and I want you to get in a dark room and stay there for 7 hours. Unfortunately, that's not possible for some people. But that's the type of thing we try to do. We try to, when people are changing shifts, that might be a place where we suggest they try a little melatonin. Are you familiar with melatonin, Angela?
Yeah, that works quite nicely. It doesn't seem to leave a hangover either.
Well, the nice thing about melatonin is a substance. It's a hormone, and it's basically all living creatures produce melatonin, And with sun exposure, when you go out in the daylight, you get exposed to daylight, and your melanocytes produce melatonin. And when the sun goes down, melatonin makes you want to go to sleep.
Huh.
And it's a natural, primordial thing that we all have. This is how we respond to it. And I think for people who are working shifts and having to change shifts, obviously they might not be in a position to get some sunlight. So when they want to change shifts, they can take that melatonin, and that many times will help them move on to their next shift.
How about a suntan bed? Would that help them get that melatonin going on?
You bet. It works the same as you know, Angela, and many of my patients will tell me, they'll say, Dr. Forsyth, I have horrible problems all week. I can't get to sleep at night. But when I go to the coast on the weekend, or if I'm working in my yard gardening, I cannot keep my eyes open past 9 o'clock at night.
Huh.
And that is especially so people when they go on a camping trip where they don't have the light in the background, when they're living on natural light with campfires. And obviously if you're in a camping situation, a real camping situation, where you don't have electricity, basically with the low light levels, people get pretty sleepy.
Mm-hmm. Yeah, definitely. Plus, you're bored. There's nothing else to do.
Oh, come on, Angela. I thought you were one of those people to sing around the campfire.
My idea of camping would have to involve a cappuccino machine and really soft bed.
Yes, I guess you're right.
Okay. But, I know sometimes what I've done when I've had trouble sleeping is I've bought a fan, just to kind of have that white noise to drown out some other distraction noise. Maybe that could be helpful too, huh? Excellent
ideas. I think, Angela, a lot of people come across these ideas on their own. Unfortunately, some of the ideas that people come up with can be pretty aggravating to the person who has to sleep in the bed beside them. For instance, some people want to get their mind to relax or disengage. They'll want to have a television or something in the room, because if they watch some mindless type of program, it helps them disengage from the day. But I think you make a very good point with this white noise. I think what we try to do is we try to set up everything in that room geared to sleeping. Number one, we tell people, don't go into that bedroom unless you have a good reason for being there. It's not a good place to be lying around during the day. We try to tell people reading a book is okay, soft music is okay, but you don't want to be the bed should be for sleeping, and having that white noise in the background with that little humming fan is an excellent idea that many people use this.
Yeah. So don't have all your homework spread all over your bed.
No, I tell people that it's a very good idea to read. It's a very good idea to even read a bit of a challenging subject, but not in your field. Because all that's going to do is you're not going to be able to disengage. You're going to be worried about what's going to go on tomorrow or whatever. Another thing I suggest to people, if they do wake up in the middle of the night and they have this fear or anxiety about worrying about work, and to tell them to just go into, and we'll talk a little bit about relaxation therapy in a minute, but to tell them to get into just a relaxation phase and forget it, there's some people who can't do that. So I would say, well, look, take 5 minutes, worry about what you're going to worry about, but say, look, I've reached the point that this is the most I can do. You can think about your problems for 10 minutes and then say, enough's enough, and then try some relaxation therapy.
Well, maybe you could share with the listening audience some of these cognitive relaxation therapy techniques.
I was at a meeting one time, and I was being trained on the relaxation response. And this is basically just a meditative response. This is a well-known phenomena, just like we have the stress response, which we all know, the fight or flight response. We also have a natural response, which is the meditative response.
Mm-hmm.
And we call, there's a fellow, Dr. Benson at Harvard, who's done a lot of meetings on what he calls the relaxation response. But the relaxation response is, they were teaching us how to get into the relaxation response. And they said, well, don't do it right after a meal, because it's hard to go into the relaxation response after a meal. And don't do the relaxation response when you're lying down, because you're likely to fall asleep.
Huh.
And I said, oh, really? So I started just incorporating that into my dealings with my patients.
Right.
You basically, the relaxation response is quite simple. You lie down. You try to get in a very comfortable position. Relax your limbs. Don't have anything crossed. And basically start taking some slow, deep breaths. And you can visualize a picture in your mind's eye, something that you find very relaxing. It could be the beach. It could be anything that you find, snow-covered mountains, whatever, sailing, and you visualize that. And at the same time, you repeat a short phrase. It could be peace and harmony, anything that could be on a religious, if you're a religious person, and you repeat this short phrase at the same time that you're taking these slow, deep breaths, while visualizing this picture.
Mm-hmm.
And what happens over a few minutes after doing this, you will find that you can feel this sensation where your body kind of, it's almost like a feeling of euphoria. And you can actually feel this kick in. Now, some people initially can't get into that because they're so worried about problems during the day that that these things, they can't keep this train of thought. So instead of getting angry with oneself and saying, I can't do this, this is for somebody else, all you do is say, oh, well, let those thoughts pass through and then go back to doing what you're doing. And most people are able to develop this skill, and actually a lot of people will tell me that they can get in the relaxation response when they're running. It's a very comfortable response. And the nice thing about it, Angela, it makes you very open to learning. So if you're having, just like people when they're really, really stressed, find sometimes they can't remember things. When they're in the relaxation response, many times it opens up their mind to suggestion.
Well, that's interesting. So that's a good thing to try. Some of the other things I heard about, I mean, some people might think, gosh, I can't go to sleep. Let me drink some alcohol. Let me have a glass of wine or a beer. But that can kind of have some negative long-term effect.
Exactly, Angela. I am totally against alcohol as a medicine. There's just so many side effects from alcohol, and as we all know, it's a drug actually that can increase tolerance. People start having one drink to get to sleep, and then they have a couple of drinks, and as you know, alcohol affects your glucose metabolism, and some people drinking a lot of alcohol can get hypoglycemic later on, and it can actually make their sleep problem worse. Yeah,
it was mentioned that it would actually cause them to actually wake up during the middle of the night.
Exactly. Yeah. With hypoglycemia and as you know, alcohol is considered in the sedative class. So when it wears off, you can actually get a rebound. But it's just not. I strongly discourage the use of alcohol.
Okay. Well, I know, we hear the commercials about Ambien and some other choices as well. And but I guess, first try these other techniques first and see if you can control it without medicine.
Exactly. I think most people. And I'm not against using Ambien and these other drugs, Lunesta, etc., for short-term usage. And then, of course, there's just some people who really are very resistant to change. And to me, it's much more important that they sleep.
Mm-hmm.
I have my own theories, but patients need to sleep. And if they really have given every effort or are not willing to make these behavioral changes, then I think that these drugs have their place. And I don't think the habituation problem is a significant problem with these drugs. I don't think it's non-existent.
Yeah.
But I think they do more, for a lot of people, they do more good than harm.
Sure. Well, it's better than a six-pack.
That's exactly right.
We're going to take a quick break to listen to our sponsors, and we'll be right back after these messages.